my name's Dr. Jan Jones, and in this video we are going to be looking at the temporomandibular joint, or the TMJ, which is this joint right over here. Now you might have some pain inside that joint, you might have locking of the joint, you might have clicking of the joint, you might even have some pins and needles and headaches with it then as well. So this video is designed to go through a host of exercises and techniques that you can do to help work with this joint. So as with any other form of exercises, be careful. If anything produces pain, stop. Don't push through pain. If you are doing movements, move up to the point of pain, don't push through the pain. The idea here is to create more movement and function. The idea here is to get the muscles to calm down and relax. Doing all of those should then help for the TMJ, the neck, to calm down. TMJ is different to other joints in the sense that it's made from a different type of cartilage that helps to reshape and remold over time. That means with exercises, we can make it move and function better for long term. With the first exercise, it's very, very simple. Every morning, make this part of your normal toothbrushing routine. Put your finger on your chin like this. And the idea then is to open and close your mouth in a straight line 20 times. Now you might notice that your jaw might do what we call a C-gate pattern, or it might even do what we call an S-gate pattern. It can actually go all over the place. So the idea here is that you force the joint to go in a straight line 20 times, and do that every day. Now this takes probably about 6 months to help to reshape and remold the joint up in there. The next section I'm going to look at is just general range of motion of the jaw. So we've already opened and closed the mouth 20 times. There's a few more movements we can do than that. It's going to be sideways movement, and it's going to be protraction and retraction. So sideways movement is going to be, okay, and then protraction is, and retraction. So you're going to pull some really funny faces in the mirror. Okay, luckily there's nobody else to see you around. So the ideal here is that we want to do 20 movements of each. So you can do one, or you can go 1, 2. It's up to you which way you want to do it. Okay. Ideally, with a specific technique out there, total muscle release, what you want to do then is go one way, the better one of the two 20 times, and then you go into the worst one of the two 20 times. Okay. Then same with the protraction and the retraction. So let's say you've got very little movement going forward, then you go backwards 20 times, and then forward 20 times. Now just a side note, when you do protraction, it's not unusual to hear like weird sounds in your ears. What that does, it means that you're tractioning on the eustachian tube, and that can trigger some noise into the ear as well. Okay, you're not causing damage, you're not going to give yourself tinnitus, so you don't have to worry about that. Sound good? Right. So that's the range of motion exercises that you can do in and around the jaw to help movement like that. So just to recap, open, close 20 times, left, right 20 times, forwards, backwards 20 times. If you do the TMR technique, 20 times to the good side, 20 times to the bad side, and do that for a while. The next exercise is going to be specifically for these muscles into this area here. Now what often happens is that these muscles become very tight and tense and stiff. So we're going to do a technique that's called PNF, or proprioceptive neurofacilitation. So the idea here is that we're going to be creating movement through the joint while applying pressure against it. So you take your hand like this, put your thumb underneath the chin there and on the top here. So the first exercise is going to be opening against resistance, so down in this direction. Second exercise is going to be closing the mouth into that direction against resistance. The first one looks like this. And then closing against resistance. Now you can do them both at the same time. So that's proprioceptive neurofacilitation of the TMJ joint. The next exercise we're looking at doing, and this is to strengthen up the muscles in and around the joint. So we're going to do another technique called resistance isometric techniques. Now what this is again, it's open against resistance, move against resistance, but not moving the joint. So this is what it looks like. So the first one, we're going to look at opening the joint. So I'm going to put my hand like that. I'm not moving the joint at all, but I am resisting against my hand. So I'm doing that movement into my thumb, and then doing that for 10 seconds. Then we're going to do the opposite, closing this time. Again, that closing movement, but resistance against the thumb. And we're going to do that for 10 seconds. We're going to add a few more movements here. So we're going to move sideways movements now. So that way and that way. So firstly, for 10 seconds, for 10 seconds. And now there's two more left. One's called protraction and one's called retraction. So pushing that jaw forward, and retraction's pulling the jaw back. So for 10 seconds, and then with this one you can put your hands just behind the angle there and pulling back for 10 seconds. Okay, careful when you press there, some people are a bit tender and sore, just be aware of that. Next, we're going to go into what I call some massage therapy just over the main muscles that's involved in and around the TMJ. So we're going to do some just circular massages through what's called your masseter muscle, which is in this area here. And we're going to just work it 20-30 seconds. And we can just work it nicely like that. The next big one is called your temporalis muscle, which is the muscle, a big fan-shaped muscle just over here. And you can just do nice 4 fingers like this. Massage nicely into there. Right. So you can do this for 30 seconds both sides. Then the next one is going to be base of the skull through here. Now the upper neck plays a big role in the function of the TMJ as well. So there's a big mechanical link between the upper neck and the jaw itself. So with this one, you take your fingers and you're going to roll right up into this area here. So you want to do that again for about 10-15 seconds just to get some circulation in there. You can extend it up to 30 seconds if you want to. So just to recap, areas we're going to massage through here, and then through here. Okay. The next section we're going to do is going to be a little bit painful. This is what we call ART, or active release technique. Now very often when you feel around in this masseter muscle here, you might find a knot there that kind of bring tears to your eyes. Nice and exquisitely painful, and the harder you press it, the worse it gets. So don't press it too hard. Okay, with the ART technique, what we're looking at doing is we apply pressure into that muscle that's bearable, and then opening and closing the mouth while doing that. And we do that slowly 6 or 7 times. Okay, it's going to be painful, be aware of it, but you find that as you start doing more, it's going to start to free up more and more as we go along. Okay, next one, same technique, this time for the temporalis. Now some people have these spots in the temporalis here that again bring tears to the eyes, nice and painful. So those are the spots you're looking for. Apply medium pressure and then open and close the mouth 5 or 6 times while applying the pressure. What this does, this helps to force that muscle to relax some more. Now, we are finally becoming to a point where we're going to do some joint movements. Now, the joints we are going to be moving and working on specifically is going to be the TMJ joint, the hyoid bone, and the upper neck. Okay. Now we're not going to crack the joints. We're not going to do anything weird with them. We are simply going to help them move a bit better. So with the TMJ, what you do is you're going to start by taking your thumbs like this. You're going to put your thumb behind the ear in that position, and you're going to gently push forward like that. So from the other side, gently push forward like that. So both hands up there, and you go gently pushing forward like that for about 15 to 20 times. Okay. The next one is we're going to then work on moving the joint down into that direction. Now for this one, if you're squirmish, get yourself some gloves, okay? But we're going to stick our fingers in our mouth and we're going to move it up and down. Now the idea here is that we're moving it down like this, not opening. So pulling down, not opening. So you take your fingers like this. So you put your thumb down there. So what I'm doing is I'm putting my fingers in there and I'm pulling down in this direction like that. Okay, so I'm pulling down into this direction. It's gonna feel weird. Don't bite yourself. Okay, a lot of people are tempted to bite themselves. Don't do it. Okay, so that's what we're looking at doing through there. The neck mobilization is quite an easy one. With this one, we're going to take two thumbs like this, like that there, and we're going to just tilt the head side to side, and then we're going to just rotate it left and right. So, like with all the others, we're going to stick to the number 20. So you're going to go, you can either do 20 times like this, or we can do the TMR method again, 20 times to this one, and 20 times to the not so good one. So, you can also do up and down. So there's three maneuvers. There's the tilting, the rotation, and up and down. Now, like I said, the goal here is to get some movement in here, not to crack the neck or to create any weird movement in that sense. So to recap, we've done a lot. We've gone through the basic maneuver to help improve the joint function itself with just opening and closing. Okay. We've gone through the rest of the movements being the protraction, retraction, sideways movement, so the rest of the range of motion. Then from there, we've done the PNF technique, which is opening and closing against resistance. Then we've done the ART technique, which is pressing on certain muscles here and here to help with movement and releasing the muscles from there. And then lastly, we've gone through the joint movement techniques, which is through TMJ, just forward like that, down like that, and then the neck movements, sideways, rotation, and just a gentle pull up. So these exercises should cover most of the conditions and issues in and around the TMJ. So as with any other form of exercises, be careful. If anything produces pain, stop. Don't push through pain. If you are doing movements, move up to the point of pain. Don't push through the pain. The idea here is to create more movement and function. The idea here is to get the muscles to calm down and relax. Doing all of those should then help for the TMJ, the neck, to calm down. I also have other videos on neck stretching. Good idea to do the neck stretches. Good idea to do some of the neck strengthening exercises as well. This has been a long video. I hope you've enjoyed it. Please like and subscribe my video, and I will produce some more in future. Have a great day.